Birth preferences. So these will be the specific desires that you have for each individual phase of your child's birth. And once you hone in on what those specific desires or preferences are, you'll be able to make a very clear and concise 1 to 2 page document that will serve really as your map to your ideal birth. And you'll be able to present this document to your care provider and to the additional supporters that you will have during your birth. And this will help to inform them throughout your birthing experience. All right, so we'll be talking about how to set a tone of unity when you are presenting these preferences. Preferences for the beginning of labor, opening and thinning phase, the descent of baby, the moment of birth, and your preferences for how you want baby to be treated after birth. All right, so setting a tone of unity. All right, so when you're presenting these preferences, it's really important to have a non-confrontational manner about you. You're not going to battle over these preferences. You're just saying, look, this is what I want for my birth experience. And let your care provider, your supporters know that you're all going to be working together. You all want the same goal of a healthy mother and a healthy baby. So it's definitely not you against them. And you can let them know that these are preferences, they're not demands. Of course, if there is a special medical circumstance that comes up that needs action, that strays away from your preferences, of course, you'll be open to talking about different options in the sake of your health or your baby's health. All right, and these preferences, they're really setting you all up for success, and they're a way for you all to cooperate and be on the same page. So let everyone know that. And to ensure that it's easy for you to set this tone of unity, go ahead and write out a little letter or a script that you can use, detailing the wording that you want to use when you are, again, presenting these preferences. All right, so this is how your preferences will start out. It'll have your name on the top. Don't worry, I'm going to give you a template with all of these preferences at the end of this recording. So you don't have to write all these down. You don't have to remember them. I've done most of the work for you. You'll just kind of cut, paste, and edit when you're actually ready to create your preferences. All right, so we request. So these are preferences for the beginning of your labor. All right, so first and foremost, for the beginning of your labor, you want to be able to do what feels good to you. So you would request to stay at home until mother is intuitively ready to go in. So these are going to vary a little bit depending on if you're going to have a hospital, a home birth, a birthing center birth. So before you make the preferences, just check in with your care provider about what their regular protocol is for the onset of labor. And of course, all of these preferences are optional. I'm going to give you a lot of different options, and you can pick and choose the ones that feel good to you. So some may really resonate with you, and some might not feel that important to you, which is absolutely fine. All right, so if this one does sound good to you, to stay at home until you're intuitively ready to go into the birth center or the hospital, or to even call your midwife over to your home, stay home. You can take a bath. You can watch a movie, which is very relaxing. It helps you to get out of your own headspace. You can go for a walk. This can really help to speed things along. Eat. Please eat. Before labor gets really, really intense, it's awesome to be able to load up on some carbs, some protein, so you have tons of energy for this marathon that you are just beginning on. Oh, and sleep and dream. So many women eventually experience some pretty intense fatigue during the later phases of their birth, often because they didn't get much sleep either the night before or in the early phases of labor. So if you can, please try to take a nap at the beginning of labor. All right. So preferences for the thinning and opening phase of labor. All right, so to be free to move. So this is a really important one. You might be the type of birther that likes to move your hips, to walk around the room, to walk outside. That might be how you get all of the energy from birth down and out of you. So it's really important, if it feels good to you, that you have the option to move around. Right? Limited vaginal exams. So it can be a little jarring to have fingers go up into your vagina, check your cervix when you are in the throes of birth. So if you do not want a vaginal exam, you have every right to decline. But it's also nice to tell them, yeah, sure, I want to know how dilated I am, but only every 3 hours or 2 hours, whatever feels good to you. But I want you to know that you have the right to request limited vaginal exams or no vaginal exams at all. All right, so to be in water, some women really thrive on being able to soak in a warm tub, to sit under warm water in a shower during labor. This can help to alleviate a lot of muscular tension. It can help to quiet your mind. It feels really, really nice. Eat. You have the right to eat at any phase of labor. New studies have shown that it is actually not dangerous to have a few light snacks during birth. And the key word here is light. You don't necessarily want to have a whole pizza. That probably won't even really sound good to you. But, having a few almonds that are rich in protein, a piece of cheese that has lots of protein. Again, the key word here being protein. You want something that's going to give you lots of energy. But know that you have the right to eat if you're called to do that. And drinking water. That is one of the most important things you can do to have a more peaceful, gentle, healthy labor is to continually drink water. And in this photo, you also see that there is a cup with some honey in it. Honey is a great way to give you a boost in energy. And there's also a little orange down there in the corner. That can be a nice way to, again, naturally get some energy. Raise your blood sugar levels. All right, so I couldn't find an attractive photo of a needle and syringe, so I put pine needles in here. I thought it was a little bit more visually pleasing. So you have the right to go without intervention. And so this is very optional. You might want intervention. You might want the epidural, which is totally fine. You might need Pitocin. So going without intervention, again, is totally your choice. This is something that you will, decide with your partner, and then you'll discuss with your care provider. All of these preferences, I highly recommend you talk with your birth companion, your partner first, and decide what feels good to the two of you. And then, of course, you're going to pass them all by your medical care provider to make sure all of your preferences are safe and actually are options for your particular birth experience. Okay, so go without intervention if that sounds good to you. All right, so we request to have a complete explanation of any needed interventions. So I think this is really important, regardless of what type of birth you're wanting. Even if you end up having a cesarean birth, I think it's really important to have a complete explanation of what's being done and why it's needed and what your options are, so you really feel empowered during each and every step of the journey to the emergence of baby. All right, you request to have natural methods to reposition baby. Maybe you won't be doing a headstand, sure, but there are a lot of really wonderful ways to reposition baby if, say they need to tweak their head a little bit to the right or the left to make sure they are in the optimal position to come down and out. A few of those methods for repositioning baby is to do the polar bear pose, which I'll show you in a little bit, to do some hip swirls. There's something called a rebozo. It's like a long piece of fabric that's wrapped around your belly and either shifted to the left or the right, depending on which way the baby needs to go. Often many nurses, midwives, doulas are trained to do a rebozo. So ask about natural ways they can reposition baby before going in and trying to manually do anything. All right, so talk about the polar bear pose. You can do this to reposition baby. So essentially you get on your hands and your knees and you lower your head down onto your hands. So your butt is up in the air and your head is just gently resting down on the bed or the chair. And this can help give baby the space to get into the optimal positioning. Babies are so smart. They intuitively know what position they need to be in for birth. All right, to be patient if labor rests. So it's very common for a labor to take a little break. If your body, if your baby gets totally wiped out, your surges, your contractions might stop for a little while. And if there's no medical urgency to get things going quickly, ask to just have some space to take a nap, to eat, to rest, and allow labor to restart on its own. And often when you're relaxed, when you have rested a bit, your labor will restart on its own. So just have trust and faith in that process.